Yeah, my name is Shubham.
Thank you, Singh. If you have any questions, you can ask Singh,
Yeah, yeah.
because it is an interesting research.
Ma'am, I want to, I need your help regarding to formulate the guidelines to prevent the harmful effects, especially in India, because I have a very less literature and how
Of
I can.
course.
Okay, we will help you with this.
Okay, okay. Okay. Any
Mhm.
recommendations from the scientific advisor? How I can make it better?
Oh, can I say? I see that Singh successfully developed some ideas, and really, just now it's necessary to point guidelines for prevention. Of course, we will use distributed in Russian Federation principle scheme of preventive measures, and in connection with pesticides, we'll formulate some ideas how it's possible to regulate the pesticide application in India, and it will be the mainest way of management of health pesticide problem. Thank you.
Sorry, it's Professor Kicha. I have the question.
Yeah.
How do you explain the notion hygienic management? The definition. It is the firstly the definition of notion hygienic management.
Sorry, sir, I didn't get you.
Give please the definition of your notion hygienic management.
Hygienic management means how we can strategically, efficiently, and effectively manage the things, so we can reduce the how we can reduce the consumption. And second thing, the hygienically means the using the personal protective equipments, and how we can change in a behavior of the people, so they when they use the pesticides, so better they can handle the things carefully.
Right. Thank you.
Mhm. Thank you for so.
The journal guidelines for the pesticides harmful effect on public health in India. As far as my report is concerned, I have completed part 1 and half of the part 2. I am working on section 3 and section 4. I will complete my project till the last of the May. Uh, as far as the my research methodology is concerned, this is the secondary research. I am reanalyzing, interpreting, and reviewing the past data. The reference, I am using the international documents, WHO, published academic paper, government document, encyclopedia, news article, review article, meta-analysis, and the textbook, etc. Uh, this is the content of my research paper, part 1 and part 2, is like an object of the study, and the conclusion, and the registration, and the references. I have prepared some sample of my work that I am placing in the upcoming slides. As an introduction, I can say the Malthusian is the idea of population. Population growth is potentially exponential, while the growth of the food production is linear. As we all know, India is the second largest population in the world. To meet the demand for agriculture goods adequate and feed the growing population, the phenomena of the Green Revolution came into the existence. Green Revolution allowed the developing country like India to overcome continued food scarcity by producing more food and agriculture product by using high yields of seeds, modify farm equipments, and substantial increase of the use of the pesticide and the fertilizer. But at the same time, have the major impact on the environment and the human health. Next slide. Uh, Part 1, global health problem classification and the hygienic regulations. Uh, Before going to the chemical safety protocol, we should know the detail about the chemicals like origin, classification, mode of action, extraction, synthesis, production, transport, and the disposal. That all things I mentioned in the slide. Through the International Program on Chemical Safety (IPCS), WHO works to establish the scientific basis for the sound management of chemicals and strengthen the national capabilities. WHO summarized scientific evidence and provide risk management recommendation of 10 chemical groups in which highly hazardous pesticides are one of them. If I talk about the classification of the pesticides, five type of classification are more common. Number one, based on the pesticide function and pest organism they kill, like insecticide, fungicide, rodenticide, etc. Type 2 based on the chemical compositions of pesticides. Type 3 based on the mode of entry. Type 4 based on the toxicity of pesticides. And last one, the very important, the based on the harmful effect on human, included both acute and the chronic symptoms. Acute effect included headache, body ache, skin rashes, poor concentration, nausea, dizziness, cramp, etc. And the chronic diseases like diabetes, hormonal imbalance, respiratory disease, cardiovascular diseases, cancer, neurodegenerative disorders, reproductive disorders. Based on the toxicity of the pesticides, WHO conduct experiments on rat and the other laboratory animal uh, by administrating a dose of pesticide and classify them into the four category. They put 28 extremely hazardous compound in class 1, 56 highly hazardous compound class 1B, 117 highly moderate hazardous compound in class second, and 248 acute hazardous compound in class 3. I have put all these compound in Annexo 1. Section 2, pesticides in environment. The pesticides will also affect environment, like effect on air, effect on groundwater, effect in soil, effect in fish and aquatic biota, effect in frogs, effect in birds, etc. Due to the lack of time, I'm not unable to explain in detail. Some of the studies shows that how critical is the situation. Pesticides in food. Different studies shows the pesticide residue in food, like in Pakistan, the goat milk. 50% of the sample of the goat were contaminated with the pesticides, and 20 to 25% of the sample of the goat surpasses the maximum residue limit. In Gujarat and in Hyderabad, in Telangana and Andhra Pradesh, repeat the same things. The people are consuming the highly hazardous pesticide like class 1, and they are consuming the non-approved of the banned pesticides. So we really think, we really reanalyze, we really think to framework the policy in order to strengthen the public health system. In fact, the FSSAI report says that 70% people are 70% product are unhealthy. In fact, in the report, there are many reports shows that the organic food, they are also having the residue of pesticides. So we can imagine, in fact, the healthy food are not healthy from the report. Pesticides health problem in urban and rural medium reviews from the pesticide load on the urban environment. Farmers in many countries demonstrate an irresponsible attitude to use storage at home and the disposable of packing. Farmer level of knowledge of pesticide safety is insufficient. Farmer did not read or follow pesticide level instruction. Farmer do not use any personal protective equipments when handling pesticides. When disposing of pesticide waste, respondent adequate unsafe practice. The same thing they are doing occurring in the urban setups. The part second, India is an example of medical and the pesticides problem. So here are the different ways to analyze the Indian healthcare system, like the iron triangle of the healthcare analytic framework. Major transition underway in India, like in demography, socio-economic transition, political transition, the epidemiological transition, public health analysis, and comparison with different other country. The some few facts about the Indian healthcare system. Indian government is spending only 1.4% of their total GDP on the healthcare system. In fact, 90 to 95% of the healthcare infrastructure are unable to deal with the non-communicable diseases. As we all know that there is a paradigm shift in the epidemiological transition. Now, more than 70% of people die in India just because of the non-communicable diseases. And Indian healthcare infrastructure is unable to deal with the non-communicable diseases. So that is why we really need to do something in the public health. So that is why I am assuming so we can put some extra effort in a primordial or 1 degree prevention or 2 degree preventions to in order to save the people of India. And the statistical data on the production and the consumption of the pesticides, India is the fourth position in the global supplier of agrochemicals after US, Japan, and China. Indian pesticide industry is biggest in Asia and fourth in the world. Indian pesticide scenario seems to be more export oriented. Analyzing the trends of the chemical pesticides consumption from different state and union territory for the period of 2014 to 19, a positive growth trend has been observed in 14 state and union territory. Uttar Pradesh, Maharashtra, Telangana, Punjab, and Haryana are the states that accounted for 62.4% of the total chemical pesticides consumption. Alone, cotton industry is consuming 50% of the pesticide consumption, and the paddy is consuming 80% of the pesticides. So we can imagine ki just because of the cotton industry, cotton is not a cash it is not a food crop, it's a cash crop. So we really we can think about so we can reduce the 50% of the pesticides consumption in India. If I talk about the production sites, so there are many hazardous pesticides like class 1 and class 2 are producing in production are doing in India. According to the WHO guidelines, they clearly said that in the developing country they should ban the extremely hazardous productions, as well as they can subsidize the rate of production of class 2 group. In the last slide, the future aspect, I am collecting the data on the impact of pesticide on the public health indicators in India. So I can calculate just because of the pesticides and the fertilizers, how many deaths are occurring in India, and what is the burden of diseases. And the last most important practical design, the guidelines for the prevention of the pesticides harmful effect on public health in India. I am thinking in a 5 ways, like at international level, at central level, at state level, at municipal level, at individual level, what guidelines we can formulate. And most probably, if I talk about the preventions, how we can encounter these situation at the primordial or one level problem. If we talk about the personal health, or how many hospitals, how many specific care do we need in this scenario. And the final is the conclusion. I am working on it. Hopefully, at the end of May, I will complete my project. Thank you so much.
Mhm.